every Wednesday, and this program aims to sensitize our communities about their health issues. And also through this program, we are so glad to thank the management of Ozone Clinic for sponsoring this program, so that's why our viewers and our listeners will know exactly their health status, and very important. And if you have been watching this program, in every disease that we have been talking about, if you have the signs and symptoms of that disease, you have to go to the hospital so that at least you will get a better treatment for that. And in today's editions, we are so glad to be joined by Dr. KG. She's going to tell us more about today's topic. And today's topic, we are going to focus more on asthma. And the asthma, we are not meaning only just for adults, but the asthma in general for children and for adults. That's why Dr. KG is here to tell us more about it. What are the factors, what is causing the asthma, and how are we going to manage ourselves if we have been diagnosed by asthma. Dr. KG, once again, you are most welcome to Your Health.
Thank you so much, SSBC TV, for having me in this health program. I'm truly honored to be here today, and I hope to provide some things valuable for the viewers and audience as well.
Thank you, KG Ramadan Hassan, for that one. All right, before we continue, because the topic also, we need the listeners and the viewers to understand when we talk of asthma. Can you elaborate for us what is asthma itself in a way that all of us can get it exactly?
Okay. Before we talk about asthma, we need to know a little bit anatomy of the lungs, in where the disease occurs there. We have two lungs, right and left. In the lungs we have some airways, we have bronchioles, and we have alveoli. Asthma, by definition, is a chronic or long-term inflammation of the airways of the lungs, characterized by hyper or inflammation, mucus hypersecretion, and bronchoconstriction. This is the definition of the asthma. That means, what I mean by bronchoconstriction, as I said or I mentioned before, we have bronchioles. So if the inflammatory or the patient is attacked or exposed to the triggering factors, there will be an inflammatory process. This inflammatory process will lead to bronchoconstriction. The bronchioles, as I said, the bronchioles, if it is open like this, if there is inflammation, the bronchioles will be like that. Okay? And this will lead to excessive mucus or mucus hypersecretion.
All right, Doctor, thank you for explaining for us the asthma itself also, but we need to look also at the main cause of the asthma for children and for adults itself.
Okay, well, we don't have an exact cause of asthma. We cannot say that asthma is caused by 1, 2, 3.
Yes.
Asthma is a combination, is etiology. The main cause of asthma is etiology, but it can be a combination between two, between environmental factors and genetic factors, which is inherited factors.
Okay.
This is genetic or inherited. What I mean by inherited is something that is coming from the families.
Okay.
Okay. If the family have asthma, you are at high risk even to develop asthma.
Okay.
This is it.
How about the environmental factors that you talk about?
Environmental factors like what? Like air pollutions, like stress or something like that. It all can be the triggering factors or can play a role in the development of an asthma. But exactly, can I say this is the environmental factors like pollution, it will be the cause? No. It usually combination between two.
Okay.
Yeah.
Then from your perspective as a doctor, you have been working in the hospital, let's look at the context of South Sudan. Let me just say per a day or per a week or per a month, how many patients that who have been having asthma you have been diagnosed?
Okay, per day, maybe 2 or 3 patients. They are visit clinic with symptoms of an acute attack of asthma. They are really ill. They are really ill. The patient came complaining of they cannot take their breath well, like all the symptoms of asthma, which I'm going to mention later, inshallah.
Okay, doctor, as you have mentioned that per day at least you will see 1 to 2, 3 patients who are having the asthma attack. But also we need to look at the asthma itself. Is there any different type of the asthma that we have?
Yeah, we have many types of asthma. We have something called seasonal asthma, which is related to the season, either the winter or raining season or something like that. Also there is stress-induced asthma, like someone who is underwent very stressful condition, they can develop the asthma. Okay, we have something called occupational asthma. Where are you work? The place that you are work on it. Okay, is the place is full of dust. There is a full of air pollutions or something like that. This can be one of the type of asthma. But here I'm going to consider in two types, which are the main two types of asthma. We have a late onset asthma and we have an early onset asthma. The early onset asthma, we can call it extrinsic, we can call it atopic, we can call it episodic asthma as well. And this type of asthma, it occurs mainly in the children, okay, and in the people who are develop IgE antibodies, okay, which can be exacerbated by environmental substances. What I mean by IgG antibodies, IgG antibodies or IgE antibodies, sorry, is the antibodies that is formed by our immune system, which is play a role in defense against the inflammatory process, okay, and those can be triggered by what? The early onset asthma, it can be triggered by what? It can be triggered by air pollutions, it can be triggered by house dust, it can be triggered by perfumes. All this can be the triggering factors. Okay. Also, it can be triggered by allergen, which is we are ingested, either from the milk, from the eggs, from the wheats, and others. The late onset, we are call it intrinsic. Intrinsic, or we are call it non-chronic, or non-atopic asthma. And this kind of asthma, or this type of asthma, is mainly occur in adolescents. Okay, and it is not, it has the extrinsic factors has no role in this type of asthma.
Okay.
Yeah.
Okay. Then the other things you mentioned very important also, and for viewers and the listeners who are getting us right now.
Yeah.
More especially you talk about the occupational asthma, and you just say a bit about it, that maybe the environment where you work in has a lot of dust and all these things. But through this program, Your Health, what could you say to the management or to the authorities, those who are having industrial or offices? What kind of the message could you say to them direct, to them to understand that we have to keep, like in terms of the hygiene or all that?
Yeah, the hygiene is very important. But if your place is full of dust, what are you going to do? Okay, either you left and you look for another job, because you are asthmatic, and the asthma have many triggering factors, and one of these triggering factors is the dust. So if you are working in the industry, what are you going to do? You cannot do anything. So because you are living with these pollutions, so either you can leave the job and look for another job, which will be very better for you. Yeah. Okay.
Then you mentioned something very good, and we need to look at since you mentioned for us the asthma and the causes and some of the other things, let's look at the signs and symptoms of it. For someone who has been diagnosed by, before diagnosis, we need to look at the signs of symptoms. Someone who has an asthma, how does that person look like? Yeah.
Okay. Well, they usually came complaining of chest tightness, which is they say that I cannot breathe well. Yes. Okay. They came complaining of cough. They're complaining of wheeze. What I mean by wheeze is audible musical sounds. You can hear it from when the patient is entering, or we can hear it through auscultations. Okay, by using this machine, what I'm putting on my neck, no, we can use it, or this we can use it, and we listen to the chest of the patient. There is wheeze. As well, I want to mention here, which is very important, the symptoms is not usually same for all patients. It differs from one to one. It differs from attack. Okay, many patients, if the attack is mild, we can call it mild symptoms. And these mild symptoms, the patient is usually complaining of cough, mild wheeze, chest tightness, and others. Also, there is another patient that complaining of moderate symptoms. And by moderate symptoms, I mean what? I mean that the breathing will be very loud. The patient will be tachycardic and tachypneic. What I mean by tachycardic, which is increase in the heart rate, and tachypneic is increase in the respiratory rate. Okay. Also, we have a severe. The patient may come with us with a severe symptoms. Severe symptoms like what? Patient may come fatigue.
Yes.
Okay. Patient may use his expiratory muscles, the muscles that we are using for expiration or inspiration. Patient may use it. Patient usually uses it in a severe case. Patient may come for us cyanotic. Cyanosis means the change in the tissue membrane color. Usually the color is like bluish color, which is mean that there is decrease in the oxygen level in the blood. and this is it can be a life-threatening condition. At the end, in the severe, now I combine sign and symptoms together.
Yes,
okay.
Yeah.
One, we can find that the chest has no airways, and this is called silent chest, which is life-threatening condition. We can lose our patient because of this.
Okay.
Yeah.
Then, do you think, from your perspective, based on what you have mentioned, is it easy for parents or the mothers, more especially who are with the children, would it be easy for them to identify that my child is misbehaving in this way? This one maybe could be one of the silent symptoms of the asthma. Let me rush to the hospital, for example.
Well, parents usually they don't like the name of asthma.
Yes.
Okay, they think about other things apart of asthma. So here I want to say that if the patient, when the family or when the parents supposed to take like a red clue like this, this patient may be asthmatic if the patient is allergic to certain types of materials. Let us say like perfumes. Some patients are allergic to perfumes.
Yes.
Okay, in a very cold weather, the patient came complaining, or the child came complaining of difficulty in breathing. Okay, over there is a musical sound. You can hear it, by the way. If the attack is very severe, you can hear the musical sound.
Yes.
Okay, all those things, it will give you alert. This baby may have something, may have, let us say, chest infection. They will say it's a chest infection. And one of the things that they like to say, okay, my children, they have allergy. Okay, they don't like the name of asthma. Okay, they make it like a stigma.
To this one.
Yeah, this is allergy. They say that they have an allergy. They don't like the name of asthma at all.
Yes.
Asthma is an allergy. What's the meaning of allergy? Allergy is something that is triggered by something. Yeah.
Yes.
And asthma is the same thing. Asthma is not triggering without any triggering factors, or the symptoms. You cannot develop the symptoms of asthma without any triggering factors. So allergy is an asthma. You have, parents, they have to accept that asthma is an allergy.
So I think it's very important for us through this program. What kind of the message could you give them? Because that stigma is there of not saying that my child having an asthma. And at the same time, as you have mentioned, asthma is one of the diseases also can kill.
Yeah.
So what kind of the message could you just say to them through this program right now?
Okay.
More especially for those who are having the stigma to asthma.
Asthma is a disease like any disease. It's like hypertension, it's like a diabetes. But what we have to put in our mind, asthma is a chronic disease. Asthma is a disease that is going to spend with you the whole life. Okay, we cannot rid of asthma. I cannot say that the patient was diagnosed with asthma and now he is okay. No, asthma is like hypertension. If you diagnose with hypertensive, you are hypertensive. If you are diagnosed with a diabetes, you are a diabetes. If you are diagnosed with an asthma, you are an asthma. You have to accept whatever you have.
Okay.
Yeah, you have to accept it. And then don't worry about the stigma. What is the stigma? If you are going to kill yourself because you don't want the name of asthma, you don't want other people to know that your child is asthmatic, you are asthmatic, you will end up at hospital in the ICU or intensive care unit, or you will end up with losing your life.
Okay.
Yeah.
Then that things we need to look at also. Do people who have been diagnosed with asthma, do they have a problem with the cool places?
Yeah. This is one of the triggering factors. Weather. Sudden change in the weather. Like very cold weather or very hot weather, it can be one of the triggering factors for an asthma.
Cold and hot.
Very cold and very hot. Even though the emotion, by the way, if you are underwent very stressful condition, you can develop, or it can be one of the triggering factors for an asthma.
So in that scenario, what could you say to people who are having asthma exactly to do when there is a cool time based on the season, whether it's hot and cold, and more especially emotional? Because it is hard at times for human being to live, doesn't have emotional things, or the weather will change, whether we like it or not. The situation
this is
can
something
do
we cannot
anything.
control.
Yes.
Yeah.
But
Weather.
what can you say to them?
We cannot control weather. We cannot control sometimes our emotions. So what I'm going to say, emotion in an area of emotion exactly. If you have a very, very good friends, friends that you can trust, friends that you can listen, you go and talk to them. Okay? You go to psychologist. Okay? You go for psychotherapy.
Yes.
Okay? This will decrease your emotional, this will decrease your stress. Okay? So here you cannot develop the symptoms. You can, okay, you may develop the symptoms, but how many times you are going under stress? How many times? Several times.
Yes.
Many times you will go under stress. So if you are asthmatic, you can imagine that if you are asthmatic, okay, during every stress, you will develop the attack. And during every attack, you will be hospitalized at the hospital. This is it.
Okay. Viewers and listeners, let's go for a short break, and then we shall be back.
Are you suffering from dental problems and looking for a specialized dental clinic? Don't travel abroad. Ozone Dental Clinics brings you home solutions to all your dental problems. We provide the following services: tooth extraction, orthodontics, pediatric dentistry, teeth filling, whitening and scaling, root canal treatment, dental implant, and many more. Ozone Dental Clinics has specialized medical crew using the latest and high-quality testing machines. Ozone Dental Clinics opens from 9 a.m. to 9 p.m. every Monday and Saturday, and from 3 p.m. to 7 p.m. every Sunday. We are located at Nimra Talata next to Antipas Pharmacy. For more information, you can call us on +211 926 5555 62 or +211 929 40 1010. Ozone Dental Clinics is the best and perfect solution to all dental problems.
Welcome back to viewers and listeners of SSBC. We're still continuing with our program. And inside the studio we have Dr. KG Ramadan Hassan. She is with us, and as we say that we have been talking about asthma for children and for adults. And as you have heard from her, she mentioned a lot of things, more especially for environmental factors, and then and also the emotional. You have to take what she said so that at least if you have been diagnosed with asthma, you will be at least in the best positions to control your asthma. Once again, Dr. KG, you are most welcome to the program.
Thank you so much.
All right. Yeah, Doctor, you mentioned a lot of things, and now we need to look at the common asthma attack trigger. We need to look at it so that at least we will know that these are the things and it's happening at this time. Yeah.
The triggering attacks or the triggering factors for asthma, it can be, like I mentioned before, sudden change in the weather.
Yes.
Either very cold or very hot. Okay. Emotional, as I said before, okay, can be one of the triggering factors. Smoker or smoke, it can be one of the triggering factors. Tobacco as well, it can be one of the triggering factors. We have some medications like aspirin, it can cause the triggering factors. We have some like medications called non-steroidal anti-inflammatory drugs, which is like painkillers. Some of the painkillers contain this type of non-inflammatory or non-steroidal anti-inflammatory drugs. And we have something called beta blockers, like propranolol. All those things can be one of the risk factors or the triggering factors for an asthma. It can be, yeah.
Okay.
Also the pollutions, the dust can be one of it. Stress condition, it can be excessive exercise or heavy exercise, it can be the cause or the triggering factors for an asthma.
Okay. Then we need to look at to the healthcare providers, and here I mean more especially like on the diagnosis of the asthma. From your experience and as a health scholar, we need to look at also, do we have enough equipment for the diagnosis of the asthma? More especially, let me look at the rural areas. People who are in the rural areas. do we have at least the equipment for the diagnosis, for example?
Okay, well, asthma, let us take it a role. Asthma, it is diagnosed clinically.
Okay.
Okay, what I mean by clinically, it depends upon the history and examination. Okay, history, it's very important to take a proper history for patient who is come or patient who is came complaining of the symptoms mimic asthma. Why I say mimic? Because we have many diseases. Their symptoms is typical to the asthma, which can be differentiated with mild things. Okay, examination as well. You have to do a very proper examinations. History, you have to ask from the age, which is very important. The first episode. When was the first episode? Okay. Are you responsive to the medications that they gave it to you in the healthcare center? Okay, especially that the inhaler, nebulizer, all those things. If you went to the hospital, they gave you nebulizer. Are you responsive? Are you get better? All those things you have to ask about it. Very important question if there is any family history of asthma, because like I said before, asthma can be inherited, which can be genetic.
Yes.
So all those questions will give me a clue. In this patient can be an asthmatic patient.
Okay.
On examinations, we have to see the outfit or the clinical features of the patient, including from if the patient is dyspneic. What I mean by dyspneic is difficulty in breathing. Okay, the patient will come to our facilities. Usually, they're putting their hand like this. We cannot take our breath. They can complain also their chest is tidy. Okay, and also sometimes you will find that the patient is using his accessory muscles. There is a muscles here, or there is muscles in the nose is flaring. It's called nasal flaring, which is include that, or which is give us clue that the patient now is dyspneic. Okay, during auscultation, we are listening to wheeze to the all over the chest, or to the specific area in the chest, wherever that was the bronchospasm occur. Okay, and this wheeze is a musical. I'm going to repeat it again. Is a musical sign or the musical sounds that we are hearing by auscultation. When we are auscultated, we can hear it, or we can hear it when the patient is coming from outside. Okay, we have something called percussion, chest percussion. We are going to percuss like this on the chest. There is something called hyper resonance. Okay, that means the patient now is distressed, and also it can be one of the life-threatening condition, and it can be life. We can lose our patient here.
Okay.
Yeah.
So if the patient came to your clinic, and then he or she never experienced one of the triggers, but he or she has some of the symptoms that you have mentioned, based on your clinical assessment or diagnosis, could you come to conclusion that this patient now, because I have this and this and this, could be exactly asthma?
Not from the first attack I will say that the patient is an asthmatic. Okay. What I'm going to add, in the history and examination, we have another things. Okay, we have something X-ray, chest X-ray, but we are not doing routinely in all patients with an asthma.
Yes.
Okay, we will do it like to take off, or like if the patient, we think that the patient is anemic or is pneumonic, which is chest infection. Now it can give us a clue. Okay, we are doing something called peak expiratory flow rate. And this is very simple, inexpensive or inexpensive device, which is called peak flow meter. Okay, and this indicates the flow or the severity of the flow, airflow, and it's variable from gender to gender. Okay, in male, let us say the normal is between 450 to 650 milli per minute. Okay. In female, it's between 350 to 550 milli per minute. This is the normal. Okay, and if it is less than 200, or it is 200, here it is indicated no, this is a severe case. If it is less than 100, no, this is a life-threatening condition, and we are going to do another things. We have something called ABG. ABG is an arterial blood gas. Yes. What I mean by ABG is a blood sample that we are taking from the artery, not from the veins. We are taking from the artery. So the ABG, the normal can be between 60 visits. So not from the first visit we will say that the patient is an asthmatic, because I told you before, we have many different diseases that is their symptoms mimic the symptoms of asthma.
Yes.
Like something called COPD, which is chronic obstructive pulmonary disease.
Yes.
Okay, which is also the symptoms can be mimic, but the triggering factors is different from the triggering factors of an asthma. It can be due to inhale of substance, like you inhale substances that will cause the inflammation of the airways.
Yes.
You will develop symptoms which is mimic to it.
Yes.
Okay. Now, from the first attack, in the second attack,
Yes.
by asking of the triggering factors, by doing a proper examination for the patient, now we will say that the patient is asthmatic, but not from the first attack. The patient comes for our clinic now is complaining of difficulty in breathing. They're complaining of cough, which is unprotective cough. They're complaining of wheeze. Wheeze can be secondary to anything. Okay,
Yes.
not from the first. Okay, you are complaining of 1, 2, 3. Now you are an asthmatic. No, you have to come. We have asked about the triggering. For the next time, we will check again if you come. We will ask about the triggering. We will give you medication if it is response, because asthma, it can be reversible. Symptoms of asthma can be reversible. Oh, it is reversible actually.
Yes.
Okay, if we give them some nebulizers, for example, or some medications, the symptoms will rid off. We can, the patient, if the patient came to us very severe, or with this very severe symptoms, if we give them the medication, the right doses, you will find that the patient is going out by himself.
Okay, this one you bring us to the question of like we need to look based on the treatment plan. How do you manage your patient? For example, when the patient was being diagnosed,
Okay.
whether severe or no, or moderate or something like that, for how long will the patient, for example, take the drugs?
Management, as you mentioned, it depends upon the severity of the condition. If it is mild, usually you can give the patient like corticosteroids, either intravenously through the veins injection, or we can give them Ventolin, or this is what is usually happened in the hospitals. They give them Ventolin through the inhalers,
Yes.
okay, or nebulizers, I mean, sorry, or we can give them, or we can give them this something is inhaler.
Yes.
Okay. In a moderate case, as we can give them the same as a mild case, but in the severe case, because it is a life-threatening condition, and we can lose our patient, and the patient is uses of the accessory muscle, and this accessory muscle will lead to respiratory fatigue, and this respiratory muscle fatigue can lead to respiratory failure, and we can lose our patient. Here, the management will be very different. We underwent something called intubation. We are going to intubate the patient. The patient will take the breath, depend on the machines.
Yes.
Yeah, we will put something, we'll put some device, we'll intubate the patient, the oxygen will deliver to the patient through machines until the patient recovers, then we can take off this machine.
Okay. Then when will the patient, for example, be advised to move with the healer, for example? Is it in a situation where the attack is happening every day, for example, or when will it exactly? Because we are talking about the treatment plan.
Okay. When you diagnose with an asthma, you have to take your inhaler whenever you go. Whenever you go, you have to take your inhaler, because inhaler is a life-saving. Okay. I know some people who advise because they don't want to use inhaler even. Okay, they say that they have a stigma from inhaler. They say that if we take the inhaler, we will develop pneumonia,
Okay.
or we will develop fluid in our chest, which is totally wrong. Okay, the fluid in your chest can be from another things, not from this inhaler.
Yes.
You can save your life with this inhaler. Okay, if you develop the attack now and you are far away from the health facility, you take the inhaler. You take the buffs until you reach the health facility.
Okay.
Yeah.
Then other things also, we need our communities to understand, like you have mentioned before, you said that asthma can be inherited, right? Then we need to look at the angle of like, we have people who are having a stigma, like if you have asthma, for example, I would just say that I don't need to be associated with you. I may also have the asthma. So through this program, can you at least make clarification for us? Is it a transmissional disease, or what is it exactly? Can it be transferred from someone to someone else? And more especially people having that, for me to get married also. If I'm a man and then a lady know that I'm asthmatic, then they will not even accept me. Or you, also a man will say that I don't like someone who has just a walking dead, for example. So through this program, what could you just say to viewers and the listeners?
Asthma is not transmitted disease.
Yes.
Okay, asthma cannot transmit it, like malaria, for example. Malaria can be transmitted. Asthma is not transmitted. Asthma is inherited or genetic. In your family, if you have someone who is asthmatic, your mother, your father, your brothers, your sister, you are at high risk to develop asthma. Okay, but now I will not say that because I'm going to marry someone, for example, he is an asthmatic. I will not marry him because he is asthmatic, he can transmit the asthma from me. No. Yeah. Asthma is not a transmitted disease. Yeah. So
what kind of advice could you say to such kind of people?
No, you can, if you have to. If you have friends who is an asthmatic, for example, me and you, you know me, okay, I'm a Dr. KG now. If you know that I'm a Dr. KG, I'm asthmatic, you run away from me. I cannot transmit for you an asthma, okay? I cannot transmit it to you. You can have a good friends, you can have a friends, you can marry, you can have a babies, you have children, you live your life, okay, as a normal person. Okay, yeah.
All right. And also the other things that I think you have talked about it, but we need to look at asthma itself. Why is it worst? And I fail to understand. The attacks normally happen during the night.
Okay.
And then at times you find out the attacks happen when you are alone. Why, for example? Is there something related to that?
Okay, when you are alone, the attack is coming. There is no any scientific explanation for this. But during at night, because the change of the weather, like I said before, one of the triggering factors is the cold weather. Okay, and most of us, they can sleep outside, and the weather is very, very, very cold. Now you will get this asthma because you exposed to the triggering factors. One of it is very cold weather and which is happening mostly during the night, especially in the rainy season.
Okay, then we need to look at as you have mentioned based on your conversations, you say that asthma cannot be cured, right? And then for people who are living with it, what is the best way of them to live with that asthma so that at least he or she will live longer too? Yeah. What is the best way for them?
Okay, what you mentioned is very important. Asthma, it is not a curable disease. We cannot treat, we cannot be like freely asthmatic, or we cannot be free from asthma. No. It is a controllable disease and preventable disease. Preventable, but you can prevent yourself from getting symptoms and sign. You can control the symptom and sign. How we are going to control this? By following what the doctor said, the instruction of the doctor. Okay, take your inhaled as doctor said. Okay, avoid all the triggering factors, dust, chest infections, cold weather, or stressful condition, emotional stress. All those things you have to avoid. By avoiding all those things, you can control your asthma. You can even your visit to the hospital will be less. I know some people, they are visiting the hospital like in a month. They can visit like 2 or 3 times because they are not following the instruction. Okay, there are some people they are visiting the hospital like 1 or 2 times in a year because they are following the instruction of the doctor. They are taking their medication whenever that the doctor prescribes for you. They are taking their medication on time. They are avoiding all the triggering factors. They are taking a good care of themselves.
Okay, then also we need to look at the angle of, for example, someone who's been diagnosed with asthma. Is it advisable for them, for example, when we look at the society and the environmental factors that you're talking about, we have people that love to be in a club, for example. And then we have people they mostly love to smoke cigarette and all these things. And such kind of the person, if he diagnosed with asthma, is it advisable for them to do these things also?
Okay. People who are going to club, you will spend there for a late time, late night hours. Okay, and this is stress. You are not getting sleep. You are not getting enough sleep times. Okay, and for example, imagine that you are going now. You went to a club. You came at home almost like 4 or 5. You slept the whole day, and you went back to the club. Okay, and you spent almost the whole night there. And you come. This is the stress. You are stressing yourself. Okay, and this is one of the triggering factors. One of the triggering factors is smoke.
Yes.
Okay, if you are a smoker, you are at highly risk to develop the symptoms more than other people who have been diagnosed with asthma. If you are a smoker, that's why from here I want to send my message. You people, if you are diagnosed, have been diagnosed with asthma, you have to stop smoke. You have to stop the smoke, or you reduce it. I know some people who can smoke like 3 or 4 boxes per day, and you are killing yourself, and you are asthmatic. Your chest is not like a healthy chest. Your lungs is not a healthy lungs. Okay? You have some constrictions, and you are adding for them with smoke. What are you going to do? You are killing yourself.
Okay. Dr. KJ, we are almost to our time, but also there is something very important we need to look at it. For someone who has been diagnosed with asthma, and then we find within the community, you find out that some of them are driving. And the attacks normally happen for some of them while they are driving, and also it can cause a lot of things. What kind of advice could you say to those who are having asthma and driving, for example?
Asthma doesn't mean that you cannot live your life. You can live your life. But we have some clues that we say that I'm asthmatic, or I'm a symptoms of asthma, I'm coming to you. Yes. Okay, if you develop this like cough, unprotective cough, if you have dyspnea or difficulty in breathing, okay, if you have like, you become like, the heart rate, some people say that, and I can hear my heartbeats, okay, there's a nearby clinic center. If you cannot drive, you can call someone. Don't drive. If you can drive, you drive and rush to the nearby clinic center. If you cannot, call someone to drive for you and go to the clinic center as soon as possible.
Okay. So because of the time, can you just give us the tips of the day and plus prevention ones, just because of the time?
Okay. First of all, Holmes' message, asthma, it's not a stigma at all. There is no something called I'm not asthmatic, I'm allergic. If you have been diagnosed as asthma, you are asthmatic. Okay. Secondly, asthma it is not transmitted from person to person. No, it's the genetic or inherited.
Yes.
Okay. Third, something if they gave you all the okay, if you have something with your memories, you have a dementia, for example, you can forget something easily. You have like 3 or 4 types of inhaler. You put it in a different places. As well, you can get it if you want. If you went home, if you go home, you can take it from there. Yes. In your car as well. You can take it from your car. Okay. Usually follow the instructions of the doctor. And there is a misunderstanding of inhaler can cause a chest problem. Inhaler can cause a water in our chest. No, this is a very, very, very wrong. Okay. Inhaler can save your life. Prevention, you have to prevent all the triggering factors. And I will say it again. If you are a smoker, you have to quit smoke. If you are a smoker, you have to quit. If you are using to take tobacco, to snuff, you have to stop. If you are doing a very heavy exercise, you have to decrease the exercises. Yes. If you are underwent like stressful condition, you have to talk with your friends. If you don't want to talk with your friends, you can talk with any psychiatrist. They will help. Okay. Usually take your inhaler.